Ethics and Regulations in AI and Health Professions Education, Listserv Discussion Round 19, Group 2. Dear faculty, mentors, and fellows of the Joint Master of Health Professions Education, we would like to invite you to a discussion about using ethics and regulations in AI and health professions education. We expect this to be a great opportunity to explore and learn about artificial intelligence from ethical and regulatory perspectives. Looking forward to your valuable response. Objectives of this session. 1. Creating awareness of AI in health professions education and its ethical and regulatory implications. 2. Evaluating the AI implementation against the classical principles of medical ethics and to explore the need for additional principles. 3. Applying ethical principles against implementation of AI, especially in the context of academic integrity and informed consent. 4. Orientation to the participation of the different entities, governments, international, and professional organizations, in governing frameworks and principles of the development and implementation of AI generally and in health professions education. Ethics. The application of classical principles of bioethics, such as autonomy, beneficence, non-maleficence, and justice is crucial in the implementation of AI in healthcare and more importantly in health professions education. These principles provide a framework for ethical decision-making to ensure that the use of AI is in the best interest of all stakeholders and ultimately the patients and the wider society. In the following 2 days we will discuss ethics and AI in health professions education in general and also specifically in relation to academic integrity and informed consent and autonomy in general. Academic integrity. The widespread use of ChatGPT and similar technologies introduced AI writing assistance applications that created difficult situations for the educators, as they can paraphrase, summarize, and even create original texts with minimal input from the learner. This raises the question of authorship, plagiarism, and academic integrity and will affect the validity, reliability, and fairness of the assessment process. Questions. Are there any directions at your institution regarding the use of AI assistants that you can share with the forum? What would be your reflections regarding these tools? If banning is an option now, do you feel it will be sustainable? What would be the advice to the learners? Informed consent and autonomy. The following clip is related to the use of AI in K-12 education. Fortunately, this situation, so far, is not real in many countries. But considering the potentials of AI, especially adaptive learning scenarios that demand collecting, processing, storing, and proposing learning solutions regarding the learners, concerns are genuine regarding learners' autonomy. Questions. Do you think that students can have the right to opt out of the AI adaptive learning if adopted by the college, authority? How the consent is to be obtained, especially in adaptive learning? How much information was explained to the students before joining, and the availability of alternatives? How the data will be used and shared and stored? Assurance of data privacy? Regulations. Over the last decade, many countries and organizations developed strategies, policies, and regulations towards regulating and governing AI activities. Certain countries even created ministries or authorities for AI to enhance their international competitiveness and soft power. For example, United Arab Emirates created the first ministry in world for artificial intelligence. Responsibility and accountability are of major concerns in the regulations of AI. Imagine the following 2 scenarios. First scenario, a medical student being assessed by an AI tool. But the AI-induced decision will affect the future of this student. If there were concerns about this decision, how to provide feedback if there was an appeal. This raises the question regarding the principle of explainability in AI. Did you encounter such cases? How was it solved? And do you have at your institutions governing policies in this regard? Second scenario, a surgical senior resident performed an emergency abdominal surgery for a patient, whom the AI-enhanced radiology solution proposed a diagnosis of a surgical pathology that needs exploration, but upon entering the abdomen, it was not found. and a variation of normal anatomy was discovered, but this variant was not fed to the AI imaging tool. Second scenario questions: who would be accountable and responsible in this case for the negative exploration? The senior resident, his attending, consultant supervising surgeon, the AI developing team. Did you encounter such cases, and if there are any governing policies at your institution? Is there any need for human oversight in AI-induced decisions, and to what level? Hope you have an enjoyable educational experience by the end of this discussion.